Good night. Good night to everyone, and welcome to a very wonderful and timely topic. Now, we are dealing with a topic that many of us as women really don't really think about on a regular basis, which is heart disease, the connection with menopause and heart disease. What every woman needs to know about menopause and heart disease. So, ladies, let's start with a truth bomb. Disease is the number one killer of women. Yeah, the number one killer of women is not breast cancer, not accidents, not even chocolate deprivation. And after menopause, that risk skyrockets. And you'll understand why as we continue. Now I know you guys are thinking heart disease. That's something my dad, my uncles, my great uncles, grandfathers, grandparents, men, the senior men in the family have to deal with. But here's the thing. Your estrogen has been quietly working as your body's VIP, heart protector for a number of years. And once menopause hits, it hands its resignation letter over without any warning. So let me tell you about Lisa. Lisa, a vibrant, active 52-year-old. She ate well, walked daily, and thought, well, she was doing everything right. Then one day she felt extreme fatigue, a bit of nausea, and some jaw pain. She brushed it off as just, getting older and all these pains and problems, these small pains, it happens. It wasn't. It was a silent heart attack. Women's heart symptoms and the dramatic clutch your chest movie scenes. So we get what we call sneak attacks. So let me ask you this. Did you know that estrogen isn't just about fertility? Did we know that, ladies? It's also about protecting our heart. It's a heart protector. If not, you'll want to stay till the end. So today, we'll cover the science behind menopause and heart health in simple, non-boring terms, how to spot early warnings before it is too late, what you can do starting from today to keep your heart strong and healthy. Plus, stick around for some bonus strategies and giveaways. Why this matters. Let's clear up a big, huge misconception here, ladies and gentlemen. Heart disease is not just a man's disease. In fact, more women than men die from it. Yes. Because women's symptoms are often different, we are undiagnosed or ignored. All of these things they say, women, you always have some pain. It's always something with you all. So a lot of the times they don't take us seriously when we complain of symptoms. And here's where menopause changes the game. What happens during menopause? These are some of the things here. Our blood pressure goes up as estrogen and progesterone decreases. Bad cholesterol rises. Belly fat sneaks in like an uninvited guest and at the holidays. But the good news, you have more control than you think. The science behind menopause and heart disease, there is a science. How estrogen protects the heart. So imagine estrogen is your personal bodyguard, keeping your arteries flexible and keeping your inflammation down. So some of the things that estrogen does when we before menopause steps in. Cholesterol, keeping the cholesterol, HDL, which is high density lipoprotein, and the bad, which is the low density hyperprotein. So it keeps them good and normal. Blood pressure, ensuring smooth circulation. Blood sugar, preventing insulin resistance and that unwanted belly fat during menopause. But the moment estrogen says, I quit the job, your arteries start to become stiff, cholesterol levels go rogue. They do anything they feel, they do what they want to do, and the risk of high blood pressure and diabetes jumps enormously. Hence the reason why so many women at a certain age group, usually before middle age and during middle age, or during the transition, menopausal transition, would find that their blood pressures, and has been going haywire, and they have become diabetic, and they are still wondering why. So listen to these statistics here. For women between 25 to 34, you might think menopause is a distant problem, but stress, diet, and birth control, yes, birth control can be already affecting your hormonal levels and your heart health. Hence the reason why when you are on birth control, we tend to tell ladies as sexual health nurses and medical doctors to take a break from it after at least 2 years. Take a year or two hiatus from it, because it tends to give you problems later on, particularly bone issues. For women 35 to 45, this is what we call perimenopause central. You may already be seeing subtle shifts in your weight, in your mood. You're having a lot of mood swings, and you're having low energy. Now, this is the time to make heart healthy changes. For women between 45 to 55, you are what we call in the hot zone. The hot zone. Whether you're fully menopausal or not, these heart risks are real. But don't worry, we'll get the solution. So what are the solutions that are there for us at this stage in our life to help decrease the chances of us getting heart issues, heart attacks, strokes, and all the issues that could make us very unstable with our heart health? So let's look at blood pressure. Risk factors that increase after menopause. Blood pressure spikes. No, it's not just because your teenager is driving now. Cholesterol may climb even if you never had issues before. Insulin resistance and belly fat. That stubborn midsection is not just about eating too many carbs. Hot flashes and heart disease, yes, those annoying night sweats may be linked to your cardiovascular health. Warning signs and misdiagnosis in women. How symptoms differ from women to men. Forget the Hollywood heart attack clutching the chest, gasping for air scenarios. Women's heart symptoms are very sneaky. They are sneakier, much sneakier than the men. So let's look at some. Jaw pain, nausea, dizziness, extreme fatigue. We're talking about happening on a regular basis now. Not just going to the gym and you come home and you're feeling you probably didn't have enough sugar in it and you went and you overdid it at the gym. We're not talking about that. We're talking about a jaw pain that comes on a regular basis. More, you're starting to get concerned. What's causing that? I didn't eat anything hard or harsh to cause my jaw to hurt. You're getting upset stomach, dizziness, extreme fatigue, and then you're having shortness of breath for no particular reason, and it makes you feel very anxious. And sometimes you're getting a tightness and a pressure or discomfort, not just pain. So at this point in time, many doctors still misdiagnose women and blame it on stress. So you have to be your own advocate, ladies. You have to check out yourself. So I hope you have a pen and a paper and you are taking pointers at this time. I hope you are taking up pointers at this time, ladies. I don't know. I'm seeing like we're getting in and out, like we're getting some problems with the internet, but I just want to repeat some of the sneaky symptoms again. We have jaw pain, nausea, dizziness, extreme fatigue, shortness of breath that feels like you're very anxious, a tightness, pressure, or discomfort, not just pain in the chest. So this is the point many doctors still misdiagnose women and blame it on stress. So you have to be your own advocate. I have to emphasize that. Be your own advocate, ladies. Be mindful. Hidden warning signs. Frequent hot flashes. They may be an early warning sign of heart disease. So I don't want you all to get frightened at this point in time too. Not all hot flashes are heart related, right? But what we are saying, check out everything and how often it comes and how severe it comes, because not all may be related to the menopausal symptoms. Feeling exhausted for no particular reason. You didn't go outside and take a walk. You're just sitting, relaxing, probably on your phone, on the computer, just watching some television, and you're just feeling exhausted for no reason. You're not even anemic, right? Meaning that you do have a low blood count, and just for no particular reason, you are feeling exhausted. Could there be more, that be more than just menopausal symptoms? New anxiety or palpitations of the heart, right? Beside the menopausal symptoms, you find that you're just being more anxious than usual, and the heart is just doing its own thing. It's time to check your heart, not just your stress levels at this time. How to advocate for your own health. Some of the things you can do. Ask your doctor for a calcium score test. And I want you all to write these down, ladies. Ask your doctor to do a calcium score test and a C-reactive protein test. Track your blood pressure on a regular basis. And what I tell patients many times when they come by me and they find their blood pressures are becoming elevated more than usual. Sometimes, a lot of women, a lot of people, when they come to the hospital or they come to a health facility, their blood pressure goes up because of just the fear being there. Some of us have a fear just being in a medical facility, which we call white coat syndrome, right? We're not just talking about that. We're talking about your pressure is just going up. You have a monitor at home, a blood pressure apparatus at home. What we advocate is that you check it twice for the day. And how you check it? You check it 12 hours apart. So if you checking it in the morning time at 9 a.m., check it in the evening time at 9 p.m. So there's a 12-hour lapse between. Do not check it if you just had a quarrel with your kids or your husband if you just came in from the gym and your heart rate is up and going on, if you're doing housework and you just sat down to just check, you will get the wrong reading. So make sure you sit down for at least 20 minutes, allow the heart rate to drop, and then you check your blood pressure. You do that twice for the day, you write the time you did it, and the results that you get, and you put it have it in you score it in a note, in a notebook for a week. And regular blood pressure range is what we generally work with. Is between 110/70 to 120/80. So that is a good way to start to check your blood pressures, because we know high blood pressures is related to heart issues. Cholesterol, check your cholesterol and your blood sugars on a regular basis. Yes, I said glucose regularly, right? To ensure that they are within a normal range. So you can go by your doctor, check your cholesterol, and do what we call a HbA1c test, right? And what the HbA1c test is good for, it goes back to the history of the cell. The cell life is generally lasts around 3 months, and it goes back to the initial stage when that cell started to become used by the body, and it checks the history of the cell before it changes and you get a new fresh cell. So it will check your glucose levels from about 2-3 months before, and so you would know whether or not your body was dealing with high sugars previously. And cholesterol tests, we do that on a regular basis. When you go by the doctor, generally they tell you have nothing to eat from the night before, sometimes generally around 10 p.m. So when you come, you do that test, you're allowing yourself not to have anything on your tummy, not eating from 10 in the night till up to the time you do the test, around after 8 in the morning, and they will check that cholesterol. Do not accept, another thing you need to be aware of, do not accept that it's just stress as a diagnosis. Insist on deeper testing, ladies. Don't let nobody brush you off and say, it's just the stress because you're going through menopause and all of these things you all women have to deal with. Go deeper, take these various blood tests to ensure that you can rule out it is not stress related, particularly if you may be dealing with probably some stressful situation, a family issue, probably death in the family, some type of loss. Make sure that you go deeper than just the surface. So nutrition for a strong heart. So what can we do to help the heart along at this time? Omega-3s. You always talk about omega-3s. Where can we get some good forms of omega-3s? Besides supplementing, you can get it from salmon, from walnuts, from flaxseed. That helps the artery to be protected. That's artery protection. Then let's look at antioxidants. Antioxidants like berries, strawberries, blueberries, blackberries. When you can get them, as much as you could, even if they are frozen, they help to lower inflammation. And we know that when inflammation is high, it can affect your heart and as well as other organs. Dark green leafy veggies, we have a lot of that in all over the world, particularly in the Caribbean, which is a natural support for low estrogen at this time. So we have the callaloo bush, we have the pak choy, bhaji, you just name it, right? So make a good combination, nice dark green foods, which is a natural estrogen support. Avoid excessive sugar and processed food. So all that cakes, biscuit, cookies on a regular basis, a high sugary drinks, soft drink juice. I'm not talking about the fresh squeezed juice from an orange or a fruit or juice thing. I'm talking about you going and buy, right? These are some of the contributors at this time to a bigger waistline. and to heart issues. Exercise and stress. What can this do? Had my share of exercise. I had my have a personal trainer now, and I take time and I do my strength training. So just about half an hour before I went online, came online, I was doing my exercise, which helps with stress management as well. So exercise and stress management is important here. So strength training, which I did some of that today, and I have about 2 more sessions for the week, and cardio, which is the ultimate heart protector. I call exercise and strength training the real youth, the real guru of youth. Exercise and strength training. Breath work and yoga is another form of exercise and stress management, which what it does, it lowers cholesterol, which is cortisol, which we know as the stress hormone. And we know once the cortisol levels are up, inflammation is up, and it makes it difficult for us to lose weight, and that all of that puts pressure on the heart. Walking after having a meal. It is not, have you ever heard many times when you have a meal, they say it's never good to lie down just after you have a meal. And that's the time when you feel more sleepy because the blood now goes to the tummy and starts to break down the food, right? So you want to fall asleep. That is the time you get up and you do some walking, a little 10 minutes, 15 minutes walk to get that blood sugar and blood pressure under control. So it is really and truly is not good to after you have a lunch, you have a meal, to lie down. Get up and walk a bit, a little 5-minute walk, 10 minutes walk, stretching, instead of just going and sit down in a chair or lying down on a bed. Some people also should consider what we call hormone replacement therapy. Hormone replacement therapy can lower heart disease risk, but as we spoke about on many other occasions, it is not for everyone. Hormone replacement therapy can lower heart disease risk, but it is not for everyone. So you can talk to your caregiver, to your that person who sees about all, that medical officer who sees about you, and you can ask them what can they do to help you or guide you at this point with hormone replacement therapy. Natural alternatives. There are natural alternatives that you can use to help with the up and down of the estrogen and the progesterone. Have you guys ever heard of phytoestrogens? Phytoestrogens mimic the estrogen, progesterone, and estrogen. They mimic them. So you can get it in foods like soy, flaxseed, and herbal supplements. Taking action. What can you do right now, today? What can you do today? So what we can do today is start at this point. You can have a personalized action plan. What can you do? Eat for heart health. When you reach a certain age group, because of what we are going through, it is harder to lose weight. And we have to eat a bit different. So one of the things we need to do at this time is to add more veggies, and which has a lot of fiber, more fruits, right? A lot of fresh salad, multicolored, so that you can get the rainbow, along with a lot of omega-3s that you can get from foods like fish and the flaxseed, and antioxidants that we can have. Move daily. Now, moving daily is one of the hardest things that we can get accustomed to, especially if we live a sedentary life or we are very busy. Some women say, I walk whole day. Where I work, I walk whole day. That is enough exercise for me. But we are not just talking, you're at work and you're doing that. We're talking about getting up and doing exercise and some strength plus strength training, which helps the heart muscle. Have you ever heard the more muscle that you have, right? Because the muscle is an organ by itself. It helps with your heart health. Also, know your numbers. When I say know your numbers, know your blood pressure. What it reads on a regular basis. Know your cholesterol levels. Don't just, I eating well, I think everything should be good. Check these things out on a regular basis. Glucose levels, your HbA1c, and other blood sugars as well. Check them on a regular basis, ladies. Right? These are the things that you can do for yourself. So what can I do again? Resources and next steps. What you can do too is download your free heart health checklist. Schedule a heart screening and join a private menopause and heart health group. Now, menopause, ladies and gentlemen, isn't the end. It's your chance to take charge of your health. Your heart beats for you every single day, never letting you down. Because the day it stops is the day you and I could die. So it's time to return the favor to our heart. Book a heart checkup. Make one change today that can affect your heart in a positive way. Your future self will thank you, ladies and gentlemen. So I would want to know, what is your biggest concern when it comes to heart disease? Is it hot flashes? Is it weight gain? Things that you can use as well, the 4-7-8 breathing exercise to instantly calm down your nervous system. I believe we spoke about that last week. And our free heart healthy recipe guide. So who here is ready to take control of our heart health? And is anyone here proactive and putting their heart first at this time? So the mic is now open for us to give our points, to ask questions to Dr. Cannon herself about heart issues, the importance of exercise. What the floor is now open, ladies.
Good night, everyone. I'm so glad to be back.
Thank you for coming. Welcome back.
And I'm
Miss
so glad.
Manzano.
Yes,
Missed you.
yes, yeah, I miss you guys. Listen, this topic is so relevant because I saw my doctor recently and I never suffer with high blood pressure, but for some reason she says she find um it kind of fluctuating and they have to watch it or either they have to put me on medication and everything when you talk about, yeah. So I really want to take proactive um
Measures.
measures to see about what's happening right now because I've never used to suffer with, anything to do with blood pressure and things like that, but I see that's happening right now. So I'm so glad that I joined in when I did today. So you'll be hearing from me what we recommend that I come and see you all in the clinic or whatever.
Dr. Kanye would like to give any comment here to anybody. Where's the best place for them to start?
Hey everyone, and good evening. Oh boy, this is like one of my favorite topics. And here's why. Here's a really good reason why. Because we have a 7-week course in the White Rose community that can help you improve your blood pressure with reducing the impact of the need to take medication, reverse your diabetes. And I said reverse, right? We may not be able to cure it, but we can definitely bring down the amount of medication you're taking and potentially lead you to taking zero medication. I'll give you an example. We worked with a client a couple of years ago. When she came in, her ophthalmologist had referred her to us, and she was seeing cross-eyed. In other words, her blood sugar was so high, I think it was above 450, right? Scary high, right? That it caused her eyes to go crossways. After 6 months of working with us, she stopped wearing the glasses, and she had these really thick, weird glasses that she was wearing. And she came off all of her medication. She was diabetic for 20 years. And actual fact, she called me the end of last year to say it's been a year and she has not gone back on medication as yet. And her blood sugar doesn't go above 120. On a good day, she's between 80 and 100 every day, right? She's religious about checking it. She checks it 3, 4 times a day, right? I actually told her to get one of those monitors so she could check because you could do continuous monitoring. So our course is built to build in the nutrition and the exercise and remove the overwhelm. What do I eat? When do I eat? Where do I eat? What exercises best matches me? I mean, like, anybody here wants to go back with Maria and do some weight training? Join her trainer? I don't. I like weight training, but not anymore, right? So each of us are different. Does anybody want to go come kite surfing with me on the weekend? And if you don't know what kite surfing is, go check it out online, right? I'm sure you're going to look at it and go, nope, I'm not doing that.
I'm
So
not doing
the
that.
course, yes, and Maria is one of our best clients. Maria herself initially started off with losing, how much is it, Maria? Tell us that story.
43, 43 pounds, ladies. And that wasn't, I didn't do any, it wasn't any science rocket kind of stuff. What I did, I started small. I started to check what I had to eat on a daily basis. Sometimes we don't know junk. We eat until we write it down. So I had my book where I tracked what I eat, not measured. I want to get me unclear here, ladies. I didn't measure. I tracked what I eat. So if sometimes I sneak in a pack of cheese sticks or I had a bad chocolate, I was honest with it myself, right? You have to be honest with yourself as how you eat. So I tracked my eating for a day, and then eventually I started bit by bit putting away the bad and replacing it with something healthy, right? That is how I started. Exercising, I started at least 15 minutes 3 times for the week, and then I upped it to a half an hour 4 times for the week. And then what I do now, I do a 30 to 45 minutes of weight training with some walking in between 3 times for the week because I try to get in at least 150 minutes of exercise every week. Sometimes it's quite difficult, but when I can't exercise the way I should, I have on my monitor. I now have it downloaded to my phone. I put in my steps. So my steps, I try to make at least 6 to 8,000 steps per day. So I try to move as much as possible. And simple changes like that, as well as sleeping on a regular basis and taking magnesium, things that I added on bit by bit. When I checked myself after about, let me say, 3 to 6 months, I don't want to lie to anyone, I was about 229 pounds. And somehow it wasn't showing because I always did weights and all of that. But my clothes couldn't lie. 229 pounds, and then I dropped from that to 185. I bob in between that amount of weight in between, but I do not go over a certain amount of weight again anymore because I know how to eat. And my aim this year is to try to get underneath a certain amount of weight again. I'm not going to stress. I'm taking my time, and I'm still a work in progress. So ladies, it is quite doable. It has affected the way my skin looks, my attitude, the anxiety, the hot flashes. It has made me give me some positive changes. So I want to just encourage you ladies, it's not hard to do. You just have to be consistent. Consistency is the key.
And that's what the course helps you do. It helps you to build that consistency one step at a time. We hold your hand and take you through this process that shows you consistent, effective results. And I can regale you with many stories like Maria, who have gone, but women and men who have gone through this course and seen immense results. And here's the thing. It's 7 weeks. Once a week, we meet for an hour or less. And you just implement the things that we show you, we coach you on implementing for that week. You come back and you add more until you have a system. And it's not my system, it's not Maria's system, it's your system that works for you. So it doesn't matter what is happening in life, birthdays, holidays, vacations, Christmas, whatever is going on, your system is in place that keeps you on the right path. So if you've ever been frustrated with dieting and all these programs and these trainers, and you get results for a short space, but you didn't get, but when after a while you stop getting results, this program is the right one for you because it consistently gives you the ability to maintain your healthiest weight. Right. And for everybody, that's a different weight based on what age you are and where you are in life. Right. So we spend 7 weeks together, and by the end of the 7 weeks, you will have a system that works best for you. We just don't work on nutrition and exercise. Big part of the challenge you face is what are the habits that you're doing every day that are contributing to where you are today. And what we'll do is identify those habits and slowly change it. So think about this. If I was to push against you, what would you do? Push back. But if I was to hold your hand, if you allow me to, that is, and walk with you, what will you do? Walk along with me. So think of your brain like that. If you push against your brain, you try to force it, what does it do? It pushes back because we are naturally rebellious. So what we do is we hold the hand of your brain and slowly walk it to a new habit. And when you reach there, it says, I love this habit, and it doesn't push back against you. So 7 weeks, the course starts the second week in March, just after Carnival, just when Lent has started. For those who are Catholic and fasting, this is an excellent way to maximize that fasting period. It starts on Wednesday, the 12th of March. Let me make sure I got that date right. Yes, Wednesday, the 12th of March. No, sorry. Thursday, the 13th of March. My bad. Thursday, the 13th of March at 7 p.m. on a Thursday night for 7 sessions. Right? If you want to learn more, contact Maria. Say, yes, Maria, I want to join, and she will give you the details of what you need to do. Right? Or you can join our WhatsApp group, which I'm going to post the link here. If you're not in a group, come join it. You don't have to join the program. But to get information about it, if you see this link at the bottom here, take a quick screenshot, take a picture. If you want, I'll put it in the chat. So I'll stop the share and put it in the chat for you. And yes, I saw the question in the chat and I will answer it shortly. All right, so here's a link. Nope, that's not it. One sec, let me just post the link. And you can join us on WhatsApp and get more information about what is happening and the course is called Healthy Weight Loss Recipe. 7 weeks, to a healthier you. Here's the link. So ladies, come join us. And here's the surprising thing about this course. It is only $497 for the entire 7-week course. Less than the cost of 2 months of a gym membership. And imagine you're going to the gym, you're just joining the gym. You haven't paid for a trainer. You haven't had, you haven't added a nutritionist or anything. All right. So to answer the question, if you're concerned about the condition of your heart, what tests should you try? All right, the tests show you its true condition. All right. It's a great question, but a little bit of a complicated question. Right? First off, we start off with the ECG. You go into your regular checkup and they do an ECG and they do some basic blood tests on you. The ECG can tell you a lot of information that combined with the X-ray, the chest X-ray, can show you the shape of the heart and give you some information about how the heart is doing. But the ECG tells you a lot of information about the heart is beating. That's the first test you would start with, right? That gives you a good example of where the condition is. Now, if anything looks unusual on that ECG, your cardiologist, your general practitioner, you don't have to start with a cardiologist. You can start with just your GP or your local health center, right? And they will do the ECG and then they will give you a referral to the cardiologist. At that point, the cardiologist will take a deeper look at the ECG, right? Because they're trained to pick up more stuff than the general practitioner or the family doctor can, right? And then they will decide if they want to go to the next step, which is doing a few blood tests to see what the heart is doing. That things are calcium, looking at different
Score test.
some cardiac parameters, right?
Mm.
And they will do a stress test, right? That's the first step. I don't want to overwhelm you with a barrage of tests that they can perform, but those are the starting points of getting your heart checked. So if you're concerned, first thing, start with your GP or your family physician or at the local health center. Request, if they're not going to do ECG, request that they do an ECG and a chest X-ray, right? Let them review it and then they will talk to you some more about what your next steps are. If you're still concerned after that, then ask them for a referral to your local health center, right? All right, so I'm going to hand it back over to Maria. And did I lose Maria? No, I didn't. All right, so I'm going to hand it back over to Maria and let her continue.
Actually, we have, in terms of the topic tonight, we have finished for tonight. So it's just the question we were dealing with, right? I would like that, people can talk and any issues you have, you could always put it in the chat box so that we could try our best to answer as clearly and simply as possible to the issues that you may be experiencing at this time. Some people don't like to talk online, so they could put it in the chat box, or we can chat even after. You can contact me after. Well, not tonight, but sometime during the course of the day, tomorrow or later on, and we can also chat. So, yeah, you have options. But heart health is very important, particularly it's one of the most important things that you can do to check your general well-being at this point of the time with this transition during this menopausal transition. It's not something that you delay until things get extremely bad. Don't wait until things get extremely bad before you say, look, let me check this out. You know, there's the saying that goes, prevention is better than cure. So that's our topic for tonight.
Yes,
And
good evening. Very good information.
good
Does
evening.
low blood pressure,
Thank you.
yes. Does low blood pressure affects the heart? A person who normally has a low blood pressure condition, does that affect your heart?
Yes, in certain cases, it is an indication that something else can be going on. For example, I could talk about myself in what I'm going through. Now, I am anemic, right? Meaning that my blood count is low. And many times when my blood count is low, I am anemic because I bleed heavy during my monthlies because this is one of the problems I am having. And when my blood count, that bleeding causes my blood count to become low. And when my blood count becomes low, my pressure becomes low. And when my pressure is low, it makes my heart have to work harder because the blood that I have in circulation it's harder for my heart to work because it has to work harder to get that blood around my system, right? And in many cases, what I've read and what I know now, the heart sometimes becomes bigger because it's trying to compensate for the decreased amount of blood that it has circulating in the system. So in that point, in the terms of anemia, I can talk about that aspect. Yes, it can. So that anemia actually can injure the heart because the heart has to work harder to get that body function and the blood around in your system. So if that is your issue, I think you normally have normal blood pressure, you need to get it checked out to see what may be the cause.
Okay, thank you.
You're welcome.
Ms. Bridget, before we answer your question, I wanted to add a little bit to Angela's question. Again, this is another complicated question to answer. I agree with Maria. Yes, getting checked out and finding out more about it is important, but it depends on what blood pressure you're talking about also. Some people say, I have a low blood pressure, and when we look at it, it's actually normal. But because of what they read on Google or somewhere else, they tend to panic a little bit. So, and then there are people who are extremely fit, who tend to have lower blood pressures and lower pulses than the regular population. Another thing is age. The older you are, is the stiffer your vessels can be. And that can have an effect on your blood pressure, which can affect how the machines read your blood pressure. But if you're not having any symptoms like fainting, nausea, vomiting, chest pain, if you're not having, and there's many more symptoms, you can always go on MedMD or one of those places and look it up. But if you're not having any of those symptoms, then you're more likely not in danger of having low blood pressure, right? There's also a condition where if you go from sitting to standing, you can cause yourself to get dizzy or faint. And that's a fluctuation in blood pressures because of gravity, right? So you see, this gets fairly complex fairly quickly. So the best thing to start off is by first checking your pressure several times a day. Try to do it around the same time every day, right? And if you see a change, and once you know what a normal is, which is between 110 to 135, that's the top number, and the bottom number is between 60 or 65 to about 80, right? Once you're staying within that range, you're pretty normal. Some people go a little lower than 110, but if you're older, you might have symptoms, or it might be stiff vessels, right? So, Angela, I would say check your pressures first, get a machine. They're fairly inexpensive to buy, and check it multiple times a day. Try to do it the same time a day. Pressures are also controlled by things like stress. It's controlled by time of the day. It's controlled by many things. If you're on your period, if you're going through menopausal symptoms, those can change your pressures too, right? So you see many things can affect your blood pressure. If you had a nice salty meal, your pressure can go up, right? So another thing can cause low blood pressure is not enough salt in your diet. Yes, we've been vilifying salt, but we do need sodium in our diets. We need a small amount, no more than a teaspoon at best every day. It's actually 3/4 of a teaspoon, right? Yes. So hopefully that answers your question, Angela. I know it might be a little confusing, but you can always chat some more with us about this if you need to, right?
Thank you. Thank you. Very good.
You're very welcome. Miss Bridget, do you have a question for us?
Good night, everyone. This is my first time here, so I just want to say thank you to Vanessa who invited me. Growing up in Trinidad, we always heard that there is a link between hysterectomies and heart health. Is that true? And if so, what is the connection?
You're muted, Maria.
Sorry about that. To be honest with you, there is a correlation, but I have not done deep studies into that correlation as yet. Right? I don't know if Dr. Khan would know a little more on that aspect, but I don't want to tell you anything 100% that I'm not 100% sure of. But there most likely would be a correlation between the removal of that organ, because that is an organ where a baby would grow. You see a monthly, there's a lot of blood there and things like that. So there is actually a correlation. And we can probably do a topic on that, Dr. Khan. What you think?
Yeah, we could probably do something on that area. But to add a little bit to what you said there, the correlation is actually linked to the ovaries itself. So if you do hysterectomy with ovarian removal, with removal of the ovaries, that leads you into early menopause or instant menopause, because just your hormones just disappear. And that menopausal change, which is what we're talking about tonight, can lead to heart issues that are related to the menopause change, right? But if they leave the ovaries in, usually there's no correlation of the removal of the uterus, which is the hysterectomy, and the vault, right, which is just the top part of the vagina, right? And there's usually no correlation between removal of the uterus and it affecting your blood pressure, right? Or your heart in any way, shape, or form. You don't lose, besides the surgery itself, which causes some level of blood loss. Once you have a good surgeon, that's very minimal. They do transfusions for that, so usually your blood pressure isn't affected in that way. But as I said, to recap, only when they remove the ovaries, then is there a significant change that is related to menopause and the impact of menopause on your heart.
Got it. Thank you.
You're welcome.
And folks, I gotta say, heart health is a very manageable thing. And I'd hate, and if you look at the cost of all these procedures they do for the heart is extremely expensive. But guess what? Nutrition and exercise are virtually free. Stress management, free. You can go watch a YouTube video right now and do some breathing, do some yoga. You can look at tons of videos on what to cook and how to cook, right? All of these things, all of these little lifestyle changes leads you to living to 100, right? And they're free. They're basically the cheapest way to treat yourself, right? So before you even reach that stage of worrying, am I going to have a heart issue? The time is now. And there's no too late to start. If you're like me and you're 50 years old, I'm only at halftime. I still have a whole bunch of playing time ahead of me. I'm going to live till 100. That's another 50 years, right? So I have plenty of time to keep my heart in good shape, right? And Maria is doing the same thing. She's only at halftime. Another 50 years to go, right? So stay on track. I know we're hitting late now. It's now 8 o'clock. So let's say good night. We'd love to take some more questions. We'll bring your questions next week. Join our group. Follow us on social media on the YouTube, The Healthy Reset, right? Follow, like, share, and it helps us grow our community and help you all. And remember,
Before we go,
ultimate weight
before you
loss.
go,
Yes.
before
Close
you
it
go,
off,
I saw
Maria.
one question somebody asked. Yeah, to close off. Somebody asked, is it true that you have in order for you to know if you're menopause, if you have to go 12 straight months without bleeding? Yes. 12 consecutive months, what we say in the Caribbean, 12 straight months without having a monthlies, you can definitely say that you are menopause. It has to be 12 months consecutively, not 3 months and then a period come and then it starts back. 12 months straight without having a monthly. Yes. That somebody just asked that question. So I just wanted to answer that before we close off. Dr. Khan, you can close off. Thank you.
Yes. So I want to say, remember, Ultimate Weight Loss Recipe starts March the 13th. That's a Thursday, 7 p.m. Liz, come join us. I can give you some really good information on how to keep your pressure under control, right? And it's $4.97. You have Maria's phone number and our WhatsApp group in the chat. Save the chat so you can always download it and see it. If you want to learn how to change, save the chat. If you're on your computer, there's 3 dots at the top of the chat. If on your phone, you might just have to take a screenshot of the chat, right? And that's it for me. Maria, close us off, and pleasant evening to everyone.
So, a pleasant good evening to everyone again for coming. And this topic is really, really timely. It is necessary. And I think we may have to do it sometime again before the year closes, right? Your heart is always going, because the day it stops, the day we cease to exist. So taking care of your heart should be your #1 focus at this time, particularly through this transition. So let's start with small changes, ladies. Start with the small changes, the course that we have doing and all of that. So your health, as I say, is your responsibility, nobody else's. So take your health in your hands. So thanks again for coming, ladies. Thank you, Dr.
Thank you
Khan.
so
Thank
much.
you, everyone.
Good night.